Continuing on with chapter 83, we're now going to talk about medications for those with diabetes. So like I mentioned in my last video, if someone has type 1 diabetes, they are insulin dependent. They will likely need different types of insulin to adequately manage their blood sugar levels. So we have rapid onset insulin, fast acting, intermediate, and long acting insulin. And we'll get more into those here in a minute. So the patient can give themselves insulin with like an insulin syringe. They can use a pump, which delivers insulin through a needle in the subcutaneous tissue. If they have a pump, it's recommended that that needle be changed every 2 to 3 days to prevent infection. Or they can use an insulin pen. So in terms of the different types of insulins, I would recommend getting out your pharmacology book and turning to the unit on the endocrine system and checking out the table, which talks about the onset, peak, and duration of each of these insulins. I think that's important information to know for ATI. So a rapid acting insulin, this is Lispro or Humalog. It is, the onset is less than 15 minutes, so it's very quick. So if you're administering this, you need to administer with a meal, like right before a meal, not 30 to 60 minutes before the meal, but as the meal is showing up right then. The peak happens at 30 minutes to 1 hour, and the duration is 3 to 4 hours. In terms of short-acting insulin, this is regular insulin or Humulin or Novolin. This has an onset of 30 minutes to an hour, so that's how long you should give it before their meal. So give it 30 to 60 minutes prior to their meal. The peak for short-acting insulin is typically 2 to 3 hours, and the duration is 5 to 7 hours. Intermediate-acting insulin, one example of that is NPH. So the onset for intermediate-acting insulin is between 1 and 2 hours, peak is 4 to 12 hours, and duration is 18 to 24 hours. So NPH is really used for glycemic control between meals and at bedtime. So NPH is the only insulin that you should mix with a shorter acting insulin. So we don't mix long acting insulins with shorter acting insulins, but you can mix NPH with a shorter acting insulin. What's super important to know is that you want to draw up the shorter acting insulin first and then draw up the intermediate. So clear before cloudy, okay? And then we have long-acting insulin, so Lantus or glargine insulin. So this you never mix with anything, any other insulins, no matter what. You usually give it once a day. There is no peak. The onset is about an hour, and the duration is approximately 24 hours. So it's important when you are giving insulin or when a patient's giving themselves insulin that injection sites are rotated. If you don't rotate it, you can get what's called lipohypertrophy. So you can get like development of scar tissue in this big lump there where you're continually injecting in that same spot all the time. You want to inject at a 90-degree angle. Unless the patient is very thin, then you can use a 45-degree angle. Again, you want to draw up the shorter acting insulin first, so the clear insulin, before drawing up the longer acting insulin, the NPH, okay? You want to very closely monitor for signs of hypoglycemia, and these symptoms are super important to know. So they include mild shakiness, mental confusion, sweating, palpitations, headache, lack of coordination, blurred vision, seizures, and coma. If the patient has hypoglycemia, so if their blood sugar is 70 or less, you want to give them, and they are like conscious and able to swallow, you want to give them 15 to 20 grams of a readily absorbable carbohydrate. So this can include 4 to 6 ounces of fruit juice, 3 to 4 glucose tablets, 8 to 10 hard candies, that type of thing. And then you want to recheck their blood glucose in 15 minutes. If in 15 minutes their blood glucose levels are still not within normal limits, then you want to repeat the administration of carbohydrates and recheck again in 15 minutes. If the blood glucose is within normal limits at that point, 15 minutes after you administer the carbohydrates, then you want to give the patient a snack containing a carbohydrate and a protein at that time. If the patient is unconscious or unable to swallow for whatever reason, then you want to administer glucagon subcutaneously or through IM to treat the hypoglycemia. So once consciousness occurs and the patient is able to safely swallow, then you would give them an oral carbohydrate to have after the administration of glucagon. Again, you want to check for signs of hyperglycemia as you're taking care of these patients. So hot, dry skin, fruity breath. You want to encourage lots of intake of fluids, sugar-free fluids, to help prevent dehydration. And then oral anti-diabetic medications can be used for those with type 2 diabetes. So I'm not going to go into a ton of details about these medications because I will be covering them in my pharmacology video series. But the ones that I would know from this chapter include metformin, glipizide, repaglinide, and pioglitazone. Oh, and one more, acarbose. Those are the ones I would know. I would not worry about the last three. So I find that most of the questions happen with the first 1, 2, 3, 4, 5 medications in this chapter. So I am going to stop here, and I promise we'll finish this chapter in the next video. There's like a whole section here on foot care, and I know you're like, really? You're going to spend a whole video on foot care? I am, because HI loves to ask about foot care for diabetics. So we're going to have to get really specific on this one because you'll see a question on it. Okay? Take care. I'll see you at the next video.